All right, let's jump right in. We're going to break down one of the absolute classic OSCE stations, the thyroid examination. Now, this station tests way more than just your clinical knowledge, so we're going to build a rock-solid structure to help you completely nail it.
So picture this. You walk into the room and that clock starts ticking. You've got 8 minutes. In front of you is a patient with some pretty vague symptoms. Maybe they're tired all the time, maybe their heart's been racing. The pressure is on, right? It can feel a little overwhelming, but the key isn't about knowing everything. It's about having a system.
And here is the secret to smashing it. See, every single thing you do in that station is being marked against these 3 areas. Data gathering, that's just your history and your exam. Clinical management is what you do with all that info. What's your diagnosis? What's the plan? And of course, interpersonal skills. That's all about how you talk to the patient. We're going to build our whole approach around scoring points in all 3 of these.
Okay, let's start at the beginning with data gathering. A really focused history is your first and honestly, your most powerful tool for figuring out what on earth is going on.
You want to start with questions that give you the most bang for your buck. This one? It's brilliant. In one simple question, you're screening for both hyperthyroidism, that's the feeling hot part, and hypothyroidism, feeling cold. Right away, you're starting to build a clinical picture.
Next up, you hit those big metabolic symptoms. Unintentional weight change is a massive clue. You know, losing weight even though you're eating a ton, that points one way. Putting on weight for no good reason, that points you in a totally different direction. Again, maximum information in minimum time.
And now, you kind of cast the net a little wider. This question is great because it covers the heart with palpitations, the gut with constipation, and the brain with mood and energy changes. You're efficiently touching on all the most common systems that thyroid problems can affect.
Now, this is really important. While your brain is screaming thyroid, you absolutely cannot afford to miss something more serious. The flaws mnemonic is a fantastic little mental checklist you should have running in the back of your mind. You'd never say flaws to the patient, of course, but you make sure you've asked about these red flags to rule out anything sinister. All right, so you've gathered your history. Now let's get to the hands-on part and see how we can build on that clinical picture by looking for some physical signs.
Your exam needs to be slick and systematic. Seriously. You start with a general look from the end of the bed. Do they look agitated or really lethargic? Then you move closer to inspect the neck itself. Look for any lumps, bumps, scars. To actually feel the thyroid, you want to come around behind the patient. This helps them relax their neck muscles and gives you the best possible feel of the gland. And finally, you wrap it up by checking for those telltale peripheral signs, like a fine tremor in the hands or really brisk reflexes.
This is the moment where it all comes together. You're not just a robot collecting facts, you're a clinical detective. All that information you've gathered is now pointing you toward a short list of possible diagnoses. This is how you show the examiner you have strong clinical reasoning.
And here they are, the 2 main suspects on your list, your differential diagnosis. Does the story fit more with hyperthyroidism, where everything is in overdrive, or does it sound more like hypothyroidism, where everything is slowing down? By actually saying these possibilities out loud, you're showing the examiner that you know exactly how to interpret your findings. Okay, you have your working diagnosis, but listen up because this next part is what often separates a pass from a fail. It's all about proving that you are a safe and competent clinician, and that comes down to your management and your safety netting. What the examiners really want to see is just a simple, sensible plan. You don't need to recite the entire treatment guideline from memory. You just have to say what the most important next step is. And in this case, it's verbalizing that you need to confirm your suspicion with a simple blood test, a thyroid function test, or TFT.
And I can't stress this enough. A plan without a safety net is an unsafe plan. This is where you can score huge points. You have to tell the patient what to look out for and when they should seek help sooner.
And this is pretty much exactly how you should phrase it. Use clear, simple, specific language. It's not just a vague, come back if you feel worse. You're giving the patient concrete things to watch for. It proves you're thinking about their safety, even after they've left the room.
So there you have it. It's a systematic approach that gets you from that first handshake to a safe and successful conclusion. See, it's not about memorizing a million facts. It's about having a solid structure that lets you perform confidently even when you're under pressure. History, exam, differentials, management, and that all-important safety netting.
And that, right there, is the real takeaway. Because this framework isn't just for a thyroid OSCE station, it's a blueprint for pretty much any clinical situation you're going to face in your exams and throughout your entire career.
It's a repeatable skill that builds confidence and makes sure you're providing safe, patient-centered care every single time.